Hello, and welcome to Mullen's Benefits Companion, a podcast that helps employers navigate the complex legal challenges of managing their employee benefit plans. I'm your host, Brydon DeWitt, and today I'll be joined by a special guest from Mercer, Kristin Henshaw. Kristin is a health business leader for Virginia and a senior health and benefits consultant in Mercer's Richmond office. She leads client teams in developing and executing benefit strategy with a focus on assisting clients with effective cost management and employee engagement. Welcome to the Benefits Companion, Kristin.
Great. Thank you, Brydon. I'm so excited to be here with you today.
We really appreciate you being here. We have a lot happening in the health benefits environment right now with OSHA's vaccine requirements, complying with transparency rules, the Consolidated Appropriations Act, and more. I mean, who has time to focus on 2023? But we know that employers need to be thinking about it now so they can begin their strategic planning process, a good 12 months ahead of their next open enrollment. Kristin, what are some things that employers should be thinking about looking ahead?
Well, it's a great question, Brydon. And as you know, Mercer is really big on our surveys. And in this case, we surveyed our own consultants across the country and asked them, what are our clients asking us about and what should they be thinking about? And we've compiled a list, and I thought I would share that with you today. First and foremost, cost, right? Cost is always going to be a huge component when anyone is thinking about their benefits and their healthcare strategy. We are not expecting cost trend to decrease. We all got a little bit of a reprieve over the course of the pandemic, last year, but we are starting to see healthcare costs get back to pre-pandemic levels. When you add on the delayed care from when folks just were not going out and getting their care last year, plus additional COVID costs, I think we're going to continue to see cost trends increasing.
Right. We had a period of time where over the pandemic where employers were getting rebates because employees weren't utilizing, but you're kind of, okay, that was great, but now we're going to pay the price because they put things off and now it's all going to hit, right?
Exactly. And so, as we're thinking to 2023, we really just want to make sure that all of our internal stakeholders are cognizant of that fact, right? That we're not going to see the same types of expenses that we saw in 2020 because those were artificially lower with folks not going out. So really starting to plan for that. Around the topic of cost is pharmacy costs. Again, pre-pandemic, we were already focusing on the high cost of pharmacies, drugs, especially in the area of specialty drugs, gene therapies, those expensive types of drugs that are coming out. In fact, the pipeline for gene therapy and cell therapy is really expanding rapidly. In 2008 alone, the number of products in development rose 25%. And by 2025, the FDA estimates that they'll be approving 10 to 20 gene and cell therapy products per year.
Wow.
So it's really an opportunity for, before that happens, for employers to continue down the path of how they're going to manage that pharmacy spend. And because of where these drugs and therapies are delivered, which is primarily going to be in a healthcare setting, it's an excellent opportunity to start to think about how are we going to integrate the approaches from a medical and a pharmacy perspective, right? So we've got to look at both sides of the equation there. The other things that are top of mind are accessibility of our healthcare. The benefits that we're offering are great. How are people accessing them? And so I think the pandemic really started to shine a light on not only what access people have to providers and how they see them. So, for example, we saw a lot more telehealth utilization during the pandemic as your doctor who you normally went to the office to visit had to pivot just as we did, right? So they started using telehealth more. We started using more virtual care in other aspects of our lives. And so we've really, I think, started to embrace the idea of virtual from an access perspective a lot more than we did pre-pandemic. But access is not just about getting to the providers. It's also, are we providing affordable care for all of our members? So access from an affordability perspective as well. And so making sure that we understand what the diverse needs of our populations are, and are we providing, really true accessibility? It's not really just checking the box anymore that, yes, we have an affordable health plan. Is it truly affordable? Are we addressing gaps? Are we really optimizing all that we have to make sure that all of our employees and their family members have equal access, whatever that looks like, to the benefits that we're offering.
That's as far as telehealth, and also, I guess, the network. Is that what you're like? You can have a great plan, but the network doesn't really serve the population, the employers.
That is an excellent point, Brydon. So looking at the network and even broadening that from just what does my medical provider look like from a network perspective, but also what we started again to see pre-pandemic, but got exacerbated during the pandemic. If we think about access to a network of behavioral health care providers, as an example, we know that primary care, behavioral health, those types of providers were already in a limited supply before the pandemic. It was hard for people to get in to have those appointments. So you're exactly right. From a provider perspective, it's, do we have the broadest network that people can actually get in to see a provider as well?
Right.
Yeah. But speaking of behavioral health, the other thing is, again, pre-pandemic, a lot of employers were already seeing an increase in behavioral health claims. This was exacerbated once again by the pandemic as we were all at home, locked down. Yeah. And we've started to see an increase in stress and anxiety, workplace burnout, or burnout from just dealing with the different factors that are impacting our lives. I've got childcare issues. I may have elder care issues. I may have workplace issues. And so we're starting to see more and more claims around, especially around anxiety and depression, but also from substance abuse. And so we're starting to see increases in substance abuse claims, especially inpatient claims as well. And so, really looking at the programs that our employers have in place today to provide that support to their employees and their family members around behavioral health, there may be a need to fill some gaps. So it's really, our advice is take a good hard look at what programs you have in place today and where you may need to potentially subsidize those programs with some additional resources. How are we training people, especially our frontline managers, to recognize the signs and the symptoms of potential distress in the workplace? And do we have a process and a mechanism in place to elevate that concern through maybe an employee assistance program that the employer is offering, or some other internal resource that can provide that support, not only to the employee as the employee, but also that employee who may be the manager working with that specific employee too.
Yeah, so I'm just thinking about those last couple of points that you made. It's, as we're emerging from the pandemic and so many things have changed, as employers are looking, ahead to the benefits they're offering, it's not just about cost, and it's not necessarily a cookie cutter. It's recognizing the changing needs of employees and making sure the plan addresses those healthcare needs that have changed since 2019.
Yeah, you're exactly right. And, the ways that we work and how we work have changed. And so not only do you have to think about it from, obviously employers are dealing with talent issues right now, attraction, retention, the talent shortage. So we've got a talent issue. Once we get them, now we want to make sure we keep them. And it is all about making sure that the programs that we're providing are meeting those diverse needs of our entire population as well. So what was good pre-pandemic may no longer be sufficient we may need to look at things a little bit differently to react to how we are working and living differently as we start to continue to emerge, I think, on the back end of this pandemic. So, just a couple of other things that we found, again, back to how people work now. Unlimited PTO may or may not be appropriate depending upon how, an employer is structured and the type of workforce that they have. But that is, again, thinking about how people are working differently. It's really started to demonstrate some advantages during the pandemic. It allowed for people to quarantine multiple times, potentially. It allowed people to not necessarily have to tap into all of their unused vacation time, because I think we all hoped that we would have been able to take vacation at some point during the pandemic, and we're holding them to that time. But as you were looking at benefits for the future, it is not just healthcare benefits. It is, thinking about flexibility and time off.
Right.
So I don't want to mitigate the fact that we're not just looking at the health benefits that we're providing. It's also those other things like leaves that we are providing to our employees and making sure that they have that appropriate level of work-life balance. How can we do that? We can help through looking at our paid time off strategy.
Mm-hmm.
And the last thing, once you've kind of figured out some of this stuff, or hopefully you've started to think about it, you want to make sure that the vendor partners that you're working with are advancing your goals and working with you towards achieving what you're trying to do with your strategy. And we've got some of obviously the traditional players that are evolving. If you think about your national medical carriers that you may have, or your life and disability carriers, they've been responding. But we also have new players in the marketplace. Again, as people find a need, somebody's going to create something to fill it. And so when we think about, back to your point around provider networks, is your provider offering the best network? Do they have an option for a higher quality network that you may be able to tap into and save costs, save dollars? Do they have a centers of excellence approach that you could tap into? Again, that hits quality and cost. How are we delivering primary care? Is it going to be on a virtual basis? Is it, again, something that may be more face-to-face versus virtual? Like, what do we really think we need to do? And so making sure that you're working with those vendors to advance your strategic initiatives is really critical, because you really do need their partnership to make sure that you're achieving all of the goals that you're going to set out for yourselves over the next few years as you're looking at your benefit strategy. So getting those folks lined up.
Helping clients, go through RFPs and evaluate vendors is, you don't know what you don't know. So maybe you might be happy with your vendor and maybe they are the right fit for your organization. But when you start looking at other options, you discover things that are out there that you didn't know even existed. And so it's a good exercise, periodically to definitely do a deep dive and evaluate your vendors and see what, just so that what services you're receiving as compared to other services that are out there that may or may not be suitable for you.
Oh, absolutely. I mean, and the market is changing so fast, and it could be somebody's full-time job just to understand all of the different players in the marketplace now and all the different capabilities. And so that's where you really, do want to rely on your consultant that you work with, as well as your other external partners to help you vet through that and understand, what does the landscape look like? What do we have today? What makes sense for us tomorrow?
Well, Kristin, that'll wrap up our discussion. Thank you so much for coming on to the Benefits Companion.
Yes, thank you so much for having me. It was great talking with you.
If listeners have any questions or suggestions for future episodes, please contact me. You can also visit our employee benefits page at williamsmullen.com/employee benefits. There you can find out more about our team, as well as past episodes of this podcast and legal alerts. And finally, be sure to subscribe to this podcast to be notified when our next episode posts. Thanks for listening.